So out of the enrollment packet for the health benefit, out of the handout packet for the health benefits, there are sample enrollment forms on pages H7 through H12. And this is what an enrollment form looks like, or part of an enrollment form looks like. And I bring this out here as an example so that it's easy for you to see that the Blue Cross Blue Shield, here are the circles, this comprehensive medical benefits, that's Blue Cross Blue Shield. That is a separate choice from prescription drug coverage. The prescription drug coverage is the squares. And that is a separate choice from dental, which are the diamonds. And that is a separate choice here from vision. Okay, so all four, Blue Cross Blue Shield, prescription, dental, and vision, they are independent elections. Okay. In order for the spouse or dependent children to be covered under any one of these categories, the carpenter must enroll in that category, in the Blue Cross, in the prescription, in the dental, or in the vision. But there are separate elections on the election form. There's a separate section in the form. This section here on my example on the slide is only the election form for the participant. There's another election section. See here, it highlighted in pink, it says participant. There's another election section on the forms for a spouse. And there are separate election forms for each dependent child younger than 26 or perhaps older than 26 if they're disabled. So even if the carpenter is enrolling in all four of the categories, all four of the coverages, perhaps the spouse only wants the prescription coverage, or perhaps one of the children only wants the vision coverage, or maybe the spouse works outside the home and has coverage with the spouse's employer for Blue Cross Blue Shield and prescription, or for another medical plan and a prescription plan, but maybe the spouse doesn't have dental and vision. So as long as the carpenter takes the dental and the vision, the spouse can choose to only enroll in the dental and the vision if that's what suits your individual situation. The Blue Cross Blue Shield PPO network is nationwide, as is Express Scripts for prescription. Delta Dental does the dental coverage, and VSP does vision coverage. So you can certainly use these benefits out of state. The only thing I would say is that if you are having services in another state, maybe you're out in New York or Arizona or California, when you go to your provider, make sure your provider knows that you have Blue Cross Blue Shield of Illinois so that your provider bills properly. That should be evident to the provider by your group numbers, your group codes, the information on your card, but it certainly would not hurt to point out to an out-of-state provider that you are with Blue Cross Blue Shield of Illinois specifically for the Blue Cross benefit. The prescription, dental, and vision shouldn't matter because those networks just process out of one central place. So what happens if you do not elect retiree health benefit coverage at the time of retirement? So I already talked about if you don't take vision or dental, you can enroll in those coverages during the open enrollment period annually. But what if you don't take the Blue Cross Blue Shield, or what if you don't take the prescription drug coverage? Okay, so you can postpone coverage under the retiree plan, provided that you and any of your dependents that you might want to enroll in the retiree plan at a later date, you have to have continuous coverage with another health care plan. So if you don't take coverage at the time your pension starts, maybe because you've got other coverage with another health benefit provider, say for 2 years, at the 2-year mark, when your coverage with your other provider ends and you want to come on to the retiree health benefit coverage at that time, you can do so, but you will be required to provide us with proof of what's called continuous coverage, continuous creditable coverage, really. The retiree health benefits must begin immediately following the termination of coverage under the other health care plan. Okay. And you need to request and return enrollment forms to the fund office at least 30 days before the coverage with the other plan will stop. It will be your responsibility to provide proof of continuous coverage with another health plan with another insurance plan when you want to come on to the retiree plan. So you want to make sure that you keep your annual 1095B forms, the tax forms that the insurance companies need to send out to you to prove that you've had other coverage, or make sure that the other plan will provide you with what's called a certificate of creditable coverage, or fill out forms that we in the Retirement Benefits Department have for another insurance company to fill out in order to verify continuous coverage with another plan. So here on this slide at the end of the first bullet point, it says 105-day gap rule applies. So the 105-day gap rule talks about an allowance, sort of a special allowance for a gap in coverage. I said that coverage has to be continuous, and in general, that is our expectation, that coverage will be continuous through another health provider if you're postponing our coverage. But for example, say you're covered under your spouse's employer insurance. So you postpone the retiree health benefits, and your spouse is working, and your spouse works maybe 3, 4, 5 years, after you actually retire. At some point in time, perhaps your spouse changes jobs, and your spouse's coverage through her first employer or his first employer ends 1 month, and then the spouse gets a new job, and the new job's insurance doesn't maybe pick up for 2 months, for 60 days, or maybe for 90 days. So there is a plan provision to allow for these, maybe job changes or insurance changes. 105 days is just slightly more than 3 months, really. So it allows over time, over the however long your postponement period is, to have a maximum of 105 days without other coverage. And the expectation is that 105 days, maybe your spouse changes jobs twice. So maybe one time there's a 30-day gap where you didn't have coverage because of a job change. And then there's a second job change a year or two later, and there's a 60-day gap there. Okay. At the spouse's final employment, when the final employment is ending, or when your final coverage is ending, at that point in time, there cannot be a gap between the last outside coverage and the carpenter retiree health benefit coverage starting. So the 105-day gap is really talking about gaps in coverage due to job changes. It actually originally was not written into the plan, and there was an appeal where this situation actually happened to a family, and the trustees amended the plan to be a little bit lenient to allow for some days without coverage, without continuous coverage, maybe due to job changes.